Now let's get into some basic fundamentals of life on this planet. What is disease? If you look at the word in English, it is dis-ease, and it has a purpose. What is itis? Itis is Latin for inflammation. Notice many of the diseases we treat end in itis. Enteritis, conjunctivitis, otitis, encephalitis, prostatitis. It goes on and on. All right, this is very important. The body creates inflammation in the process of healing. If you sprain your ankle, it will swell. That is not nature's way of selling prednisone. That's nature's way of trying to heal. The body creates inflammation in the process of detoxification. A drug addict goes through hell detoxifying. Inflammation creates signs of symptoms of disease. We may not necessarily want to suppress this process. This is one of the most important things that I teach, especially my associate veterinarians. It's called the healing crisis. It was actually written in the year 1875. All cure starts from inside out and from the head down, in reverse order as symptoms have appeared. How many times you will see chronic UTI, urinary tract infection, or chronic respiratory infection treated successfully, and then when you see that patient years later, it's coming in for bladder cancer or lung cancer. Here is an example. I actually use this dog as an example in the introduction of my book. This dog came to me, obviously extremely bad skin condition. He was a mess physically and also emotionally and spiritually. He was highly allergic to wool, so they took rugs out of the house. He went through an entire desensitization process. They used cortisone, antihistamines, shampoos, antifungals, you name it. And then they recommended humane euthanasia. Our therapy, we stopped all conventional medications. We used nutraceuticals based specifically on his blood results. We added in homeopathic remedies for his symptomatology, and especially we gave him time to detoxify and heal. Conventional medicine, unfortunately, is a quick fix establishment. He detoxified for over 3 months. He lost 98% of all the fur on his body, and he had excoriations and hives and welts as he detoxified. I actually recommended to the owner to go back on cortisone to bring relief. She refused because she knew he had to detoxify. 9 months later, notice the rugs are back. 2.5 years later, he used to be highly allergic to grass. He's no longer allergic because he's healthy. This is the book I wrote 20 years ago. In the beginning of the book, I wrote 17 fundamentals of healing. I could have stopped right there and the book would have been 4 pages long. But I was commissioned by Random House to write a minimum of 263 pages. This is one of those fundamentals. Disease is an absence of health, and vice versa. Health is an absence of disease, but health was here first. Disease is a process used by nature in an attempt to get itself healthy. Degenerative disease is not caused by nature. It's an aberration of nature, caused mostly, in my opinion, by man. This is a book that was given to me as a gift. It's one of the textbooks from NYU Medical School in New York for humans. It's from 1898. When I opened it up, look what I saw. These were their medicines back then. Just like some of the Chinese herbal formulations we use now are 3,000 years old. These are some of our modern day drugs. Do you honestly think that the dog or cat cares what color this is? These are toxic dyes to make them look saleable. What happened to this? I feel that one of the mistakes that man has made in the field of healthcare is they actually found the active ingredient in a plant or an herb and then made it into a chemical scientifically. Example, digitalis was the foxglove plant. The foxglove plant used properly has no side effects. Digitalis causes digitalis toxicity. All right, let's look at some of the practices. I have been called many times a homeopathic veterinarian. I am an integrative veterinarian, and one of the things I practice is the art of homeopathy. This is a 4.5-year-old cat that came to me years ago. The diagnosis by the third largest specialty facility on the East Coast of the United States was progressive fusing polyosteoarthropathy. They had this cat on prednisone for 2 months and 2 different antibiotics. Every joint was twisted and fused. This leg goes like this, that. The spine was fused in a circle. She could only move from the neck up. In a last attempt, they put her on Imuran, an immunosuppressive chemotherapeutic. When she didn't respond, they recommended euthanasia. When she came to me, this was my plan. I wanted to get her as much as I could off the drugs to reestablish liver function. In 10 to 14 days, I was going to put her under deep general anesthesia and then try to break every joint open with my hands. In medicine, it's called deankylosis. I was going to use injectable painkillers and anti-inflammatories. And then I was going to have them sign for euthanasia if I detected she was suffering too much. I gave her an injection of 7/10 of a cc, or 7/10 of a milliliter, of Zeal from Germany. A few days later, I received this in the mail. She took pictures of her because she wanted something to remember her by. I'll never forget how she walked 2 hours after we brought her to your office. The day before we brought her, the specialty facility said she'd have to be put to sleep within a week. But she was walking. By the time they drove home, she was walking in the car from the injection of homeopathy. This was a little bit after that. One of the problems is that the remedy that I gave contains less than 1 part per billion of active ingredient. It is very hard to get something like that scientifically accepted. The body heals through the autonomic nervous system. Homeopathy realigns the body's recognition of a disease. So recognition may not necessarily be physical. How are you keeping your heart beating right now during this lecture? Right now, your kidneys are making urine. Homeopathy aligns with the autonomic nervous system. Conventional medicine suppresses the autonomic nervous system. Supplements, what are they or what should they be? And are they needed by pets? The correct definition of a supplement is a concentrated food, and it compensates for the deficiencies that have been created in the food chain from nature. So supplements truly supplement the diet and then indirectly the patient. And yes, they are needed even if a patient is healthy. Every patient in our practice, which is many thousands, are on supplements. Here is an example how we work. We don't just recommend supplements, especially based on the internet. These are blood results on what looks to be a healthy patient. This is the normal reference range. Every result is inside the normal range, but in a range of 8 to 25 is very low and almost abnormal. So we like to see blood values or results that are optimal. And as they get more outside of the optimal range, we assign metabolic significance. 100 to 250, that's a normal range of 150 points. But the result is only 4 points from being below normal. On a bell curve, that's significantly important. And then we have learned over the years, based on the bloods, how to assign that into the interrelationship of the organs of the body. And we have learned all of this in vet school. The pituitary makes hormones or substances that stimulate the thyroid, that stimulate the adrenal cortex. The thymus programs the immune system early in life. These all work together. So there's no such thing as a normal dog that has a liver disease. If you take a brand new toaster and cut the plug, it will not toast bread, but there's nothing wrong with the toaster. If you take a normal thyroid and the dog has pituitary dysfunction, the dog may look like hypothyroid, but there's nothing wrong with the thyroid until you prescribe synthetic thyroid medication. Then you cut off the negative feedback mechanism, and the dog does become hypothyroid. We have regained normal thyroid function on many dogs using pituitary extracts. This is our more sophisticated program where the computer does all the work for us. And then it actually prescribes the exact nutraceuticals in the proper dosage. How do drugs and supplements interact? This is a very common question that I get. It also causes a lot of concern and blame. Actually, they work synergistically. If you give a cigarette to a person that smokes 2 packs of cigarettes a day, nothing happens. But if you give a cigarette to a person that has never smoked, it causes tremendous distress and coughing. This is because the healthier a cell is, the more sensitive it is to a chemical. So when we use nutraceuticals, we actually make cells healthier. So on a cellular level, nutraceuticals make those cells healthier. So they then become more sensitive to a drug. And guess what? You need less of the drug to create the same medical effect. There's actually a medical term for this now, and it's called potentiation. So please don't be afraid to use supplements and nutraceuticals. Essential fatty acids. This is probably the most common recommended supplement in conventional veterinary medicine in the United States. They are anti-inflammatory, they are anti-allergy, and they are immune supportive. They actually supply energy to normal body cells, and they starve energy to cancer cells. There are two main classes, omega-6 and omega-3. The omega-6 ones actually are inflammatory in nature. They cause inflammation, where the omega-3s are the ones that are anti-inflammatory. Some of the old oils that we used had a 10-to-1 ratio of 6-to-3. We want to get that ratio much lower, maybe down to 2-to-3-to-1. So the oils that do that are fish and krill oil, and coconut oil is getting good reports too for animals. But a word of caution, oils do become rancid, they spoil, and rancid oils have bad side effects. So a good oil source, either kept refrigerated or encapsulated, is what you look for. Herbs. I could spend 6 hours talking to you about herbs. There is so much to know. There are so many different herbs, both Eastern and Western. So please do your own research. These are some of the real good anti-cancer herbs. Astragalus, the Hoxie formula, Essiac formula, Neoplazine, mistletoe. And Yunnan Bio was developed in the old Chinese wars when soldiers used to get wounded and would bleed. It's great for bleeding disorders in dogs and cats. And I am seeing patients come to me from universities with hemangiosarcoma, and the universities were prescribing this herb. Aloe vera. I had some great aloe vera this morning for breakfast at the hotel. It has many beneficial properties, including anti-cancer. High in amino acids for protein synthesis, improves digestion, speeds up intestine detoxification, and topically it's great for inflammation. And topically it's great for inflammation. And one of the components, emodin, actually inhibits cell proliferation in cancer. All right, here's another great example. This is a 28-month-old Rottweiler that was carried into my clinic on a stretcher. And as you can see, he is just about ready to die. He was down to 54 pounds. His diagnosis medically was advanced inflammatory bowel disease that progressed to lymphangiectasia that they thought was an early form of intestinal lymphoma. Our therapy, he was on thousands of dollars worth of medical therapy. He was on 120 milligrams of prednisone a day. That could be up to 3 times the human dose. When he came to us, they had weaned that down to 60 milligrams a day. We went from 60 to 0. That would be considered medical malpractice. We had nothing to lose. We gave injectable homeopathics and acupuncture points. We sent him home that day, even though I wanted to keep him for intravenous. The owner was certain he was going to die that day, so he wanted him home. So we sent him home, told him to make a home-cooked diet with boiled potatoes and a few supplements and homeopathic remedies, and again, time for detoxification and healing. This is him 5 weeks later, and then one day on a Friday, the owner called me and said, "I'm very concerned." His head was swollen and blood was coming out of his left nostril. My first question was, "How was he yesterday?" And he said, "Better than I've seen him in 6 months." The healing crisis and disease look the same. The way you tell is that the patient is usually doing very well before the crisis comes. So when the owner said, "Should I take him to the local emergency place?" I asked him how many times he has been there over the last 6 months, and he said about a dozen. And I asked him, what are they going to do if you go there? And he said, they will put him back on drugs. I said, go to the movies. He didn't go to the movies, but he said goodbye to his dog, thinking he would probably die. The next day, he was not dead. His head was still swollen, but the blood had turned to mucus. In the 1800s, the medical term for toxicity in the United States was mucus. On the third day, the inflammation was down. That's him 3.5 months later on our program. Look what he looks like. He went from 54 to 126 pounds in 3.5 months. And that's him 2.5 years later doing Jordache Gene commercials. This is the miracle of healing that is missing from our profession.